You'll know if they're really still in line with that and want some changes in their life, okay? And if you keep asking the question, do you want to know more? Are you understanding this? Are you okay with this? Then that's good. Be friendly and smile, loving, warm-hearted, those kind of things. The chaplain ought to be. Listener, we've talked about that. Professional, presentable, hygiene and dress. I mean, how many people have you met? You're coming in there in a chaplain, you're close up and personable with bad breath or BO or whatever. You know, it's just ask your wife before you leave, you know, or just always do a breath mint. Every time I drink coffee or have had lunch, I go back to my office and brush my teeth. Because I'm like this a lot, folks, and I'm right in there talking to patients that are hard of hearing. I live in Florida. Everybody's hard of hearing, okay? So they don't want to smell my breath, you know? So I'm going, nobody needs to tell you. Just take care of it, okay? Those little simple things, because what would be worse than you're in a conversation and somebody's like, tell me about your faith, and you are, and they're going, oh, man. I mean, how many deterrents does it take to get them, you know, off the topic, right? Boundaries. Know what is your job. Like your brother was talking about, should I discuss advanced directive? No. Or they say, is this the right thing to do? Not our place to do that. Or to give advice on nursing or medical or procedure or the right doctor or the right funeral home or no. Okay? Know what is your place. If you're a local minister, you may say, this is the right funeral home. You can get by with that. As a volunteer chaplain, you're representing us here. Okay? So it's kind of like when you've said this is the best funeral home, this is the best doctor, this is the best procedure, you've spoken for the hospital. Okay? So it's very, very careful in boundaries. Thick skin. Hospitals are tough places. Would you say that, nurses? Woo. And I was a very thin-skinned chaplain when I came. I used to go back to my office and cry, and they don't like me. You know. I had to thicken up. It's not about me anymore. It's like, it's just they're busy, and that's just the way they are, and they're caustic, and you know, okay, learn to deal with that. Confidential. Can you, if you came in the hospital, and you saw the mayor here, what are you going to do? You going to go home and tell it? Or if you knew that came in and the CEO of the hospital was a patient? Okay? Keep it to yourself. You may say, honey, I had an experience today where I talked about this and that was so enjoyable. And this, not a name, not a patient's name, not a doctor's name. Keep it quiet. Keep it to yourself. Confidential. Yes, sir.
Does this go so far as to say you visited somebody and a few weeks later you see that person in the grocery store, you don't go up to them?
No, well, if they're okay with it, if you think...
Yeah, if they come, yeah. If you've read it, but you know, if it's been a situation, that's even...
Not necessarily. They may be offended you didn't recognize them.
Okay.
Okay. So it's all about keeping their information confidential.
And you don't have to say to them, so...
Yeah, how are you doing now? You know. But they may be offended. That chaplain came in, he was so friendly, and he ignored me in the supermarket. You know?
Because I've heard that side of it from...
No, I don't think I'd go that
ignore
far.
them when you're not in the hospital, because that's
Not
part
that
of
way.
confidentiality.
Now,
It goes back to reading.
if you worked in a psych facility, and you were, no, I do, my hospital has it, and there's psych patients. If I go out in the community and go, hey, man, how you doing? And their friend with them go, well, how you know him? Well, he was the hospital chaplain when I was in the psych room. You know, you got to be cautious, okay? There's just certain moments when you got to think, you got to read. Balance of fun and serious. I have a lot of fun, as you can tell. I have a lot of fun with it. I mean, I'm in removal of life support situations, and I come out of the room and the nurse goes, what were you all laughing about? Well, I didn't tell a joke, but there was something going on in the life of that patient that brought humor, okay? There are times, I have a lot of fun. And that's appropriate at times or not. There are some people that don't like to laugh. Back to reading, isn't it? There's some people that love to laugh. They just won't stop telling jokes, okay? I need to read that. I need to know when you don't want my joke and you want my joke. Or I don't tell a lot of jokes, but I do a lot of humorous moments. And so there are times, if you don't get a little levity in this job, if you do this 40, 50, 60 hours a week, if you don't get a little levity in your life, you're going to burn out. Right, nurses? You know, and even some nurses do some, I'm not saying you, but some crude levity that behind closed doors, you know, they're you know, dealing with life so that they can deal with tomorrow, come back in, okay? Well, some of that hospital chaplains deal with some things that are crisis, things that are trauma, things that are moment when you will go through trauma, and who deals with you? How do you vent? How do you let down your steam at the end of the day? Please don't try to be a know-it-all like me, a lecturer or a counselor. You know, this wouldn't work in the patient's room. We've got to change a motive from where we're up there on Sunday morning telling the folks what to believe in the Bible study, saying this is good, to a whole different mode when we're sitting in that chair by the bed. Some can shift that gear and some can't. Some can do both, some can't. Folks, let me tell you honestly, I am really not good at the routine visit for the patient who has a sore toe. I'm a trauma junkie. I love trauma. I love crisis. Send me to the meanest family member you know, and I can't wait to get there. People, that's crazy. I am crazy. But that's me, okay? But my other volunteers, they love routine visits. Just talking, I go, thank you, please. It's just not me. And you're going to find your niche where you go, this fits me. And you may go, trauma? I don't think so. Removing a patient from life support? Oh, I don't think so. Going to a code blue? Well, I don't, you know, well, we will train you and teach you what's necessary for you to know in those moments for those that are ready for that. To become a volunteer chaplain, in your packet there's an application form. If you want to fill that out now or later, who would they turn that into? Come to, and get your phone number that they could write down, or office number?
I've got a card, I can get them all.
Okay. So fill that out. You will go to a, do you have a orientation class that they go to for all workers or just for volunteers? All workers. So we will give you a date when the next one of those is. It's an 8-hour class. 8-hour class that all volunteers of the hospital take, whether you're working in the gift shop or wherever. Okay? And then individual orientation. I'll talk to you a little bit more on that in a moment. You will have a TB PPD test annually, and you'll get a badge and stick out your chest. Know that you belong here. I would like to talk to you all now. Some of you are local ministers that don't want to become a hospital chaplain. That's good. Some of you are volunteers of the church. That's all you want to do is just be here for your church. That's fine. Those of you who would like to become a volunteer chaplain in the hospital, give a show. At least you're thinking about it, working toward it. Okay. Would you all like for me to come back in a month or two and do another 4-hour training advanced? Just what volunteer chaplains need to know. How to respond to a code blue, what you do. How to talk to families about situations of making decisions, of life support, working through that. Not that they become at least the target person, but at least to know a little more, advance of here. Then being with the family and removal of life support. What can you expect? Maybe understanding more of the technology. What does a ventilator look like? What does a dialysis machine look like? What does a peg tube look like? What does a ventilator look like? What does an imbu bag look like? What are these kind of things? And you go, oh, well now I know what they're talking about. So when you come in, you're not becoming the expert again, but you kind of go, I know kind of what's going on. How many would like to do something like that in a month or two? You're saying it too? Good. Why don't we, anybody have your calendars and want to tell me some good or bad days.
Whatever.
Mhm.